How do mesothelioma biomarkers help detect lung cancer early? Imagine catching a serious illness before it shows obvious signs. That's what biomarkers do for mesothelioma, a rare cancer affecting the lining of the lungs. These biomarkers are substances found in blood, pleural fluid, or other body fluids that can signal the presence of cancer cells. They are especially useful because they can help detect mesothelioma early, often before symptoms become severe or visible on scans. This early detection is crucial because mesothelioma tends to grow quickly and is harder to treat once it advances. One of the most studied biomarkers is soluble mesothelin-related peptides, or SMRP. These are fragments of a protein called mesothelin that tumor cells releases into the blood or fluid around the lungs. When levels of SMRP are higher than normal, it can suggest the presence of mesothelioma. This is particularly helpful for people who have been exposed to asbestos, as they are at higher risk. Testing for SMRP is done through a simple blood test or analysis of pleural fluid, making it less invasive than a biopsy. While SMRP is quite specific, it works best for certain types of mesothelioma, like epithelioid and biphasic subtypes, and may be less sensitive for others like sarcomatoid mesothelioma. Another important biomarker is megakaryocyte potentiating factor, or MPF. It is derived from the same precursor as mesothelin and can also be elevated in patients with mesothelioma. Like SMRP, measuring MPF can help support a diagnosis. Researchers are also looking at proteins like fibrillin-3, which tend to be higher in mesothelioma patients. Combining these markers can improve accuracy because no single biomarker can detect mesothelioma perfectly on its own. Using a panel of multiple biomarkers enhances the ability to distinguish mesothelioma from other lung conditions or healthy states. This approach helps doctors identify the disease earlier, especially in high-risk groups such as asbestos-exposed workers. It's important to remember that biomarkers are not definitive on their own. They are used alongside imaging tests like CORT scans and clinical evaluations. If biomarkers suggest possible mesothelioma, further procedures like biopsies are needed to confirm the diagnosis. Beyond early detection, biomarkers can also be valuable for monitoring how the disease progresses and how well treatments are working. They can give doctors clues about whether a tumor is shrinking or growing, helping to tailor treatment plans for each patient. Ongoing research is exploring new molecular and genetic markers, such as microRNAs and DNA-based indicators, which may someday allow even earlier and more precise detection of mesothelioma. In summary, mesothelioma biomarkers are powerful tools that help detect lung cancer early by providing measurable signals of tumor presence. They are especially useful for screening high-risk populations and can support timely medical intervention. While they are promising, they are part of a broader diagnostic process that includes imaging and clinical assessment. Always consult healthcare professionals for personalized advice and diagnosis, as early detection can make a significant difference in managing this challenging disease.